Dr. David Jordan.
Older people affected by injuries, does exercise help them to recover quicker, or does it make any difference, or what?
Well, I think one area, there's certainly clear-cut evidence that involves physical activity, and that is in terms of bone metabolism and bone structure. Mentioned before that activity or inactivity affects bone mineralization and bone composition. And in the same sense, then, activity enhances it. It makes it stronger, denser, wider, thicker bone. That older people suffer from fractures primarily because of the inactivity, not because of the aging. In other words, if you were to have kept those individuals on an activity program, the likelihood of a fracture is significantly reduced. The extreme of this was, at one point I was called in as a consultant to a medical center in the Midwest to address this problem, because they had noted people that were immobilized could, by simply turning over in bed, fracture ribs. So their bone was so fragile from the inactivity that it was very, very easy to fracture. And this often happens to older people. They slow down, they're advised to be inactive or to be less active, and all that does is cause a deterioration of the system, particularly bone, and open them up to the possibility of fractures. And oftentimes when that happens, the immobilization is psychologically a disaster. They really start to feel the aging process, and other diseases tend to follow. So that type of injury especially is a problem for the older person. I don't know if you can show a change or a difference in disease patterns of old active person compared to inactive person. You would suspect, however, such things as pulmonary problems would be reduced in active people. They're less likely to have them. So the whole system really is geared up to fight disease and fight stress if it's an active individual.
I have arthritis, and it's very bad, and I can't do anything else. I just come into the wall, and it actually relieves me for the time being till I sit down, and once I sit down, it comes back again. See? But it does help arthritis, I'll tell you the truth.
And what's your name, please?
My name is Zara Bogosian.
And your age?
63.
Are you retired or about to retire?
Yes, I'm retired.
Are you retired or about to retire?
No, I'm still active. I plan to keep working.
And do you plan to keep swimming?
Oh, yes, definitely. I have to. Otherwise, I'll be kaput.
How many days a week are you in here?
I try to be here 5 days a week.
And how long have you been involved with the Y program?
Well, I came to the Y. I joined the Y after I had to recuperate from my operation and my heart attack. And that, built me up little by little. I don't actually swim a certain amount every day. I just go in there and I just move around. You shut me off.
No. No, just checking the tape. We don't want to run out. That's happened before.
Oh. But I advise this for everyone, any age, because it can't hurt you. It's the most sensible thing to do, because for one reason, you move all your muscles and you don't actually exert yourself. And my doctor even advised me to do it.
But did your doctor advise you after the heart attack to get active?
Oh, yeah, he told me so. Although I did it before he even told me.
Oh, so you were swimming before?
I was swimming before, but I only asked him a question that I should continue because my arthritis got bad. And he didn't tell me not to stop. He advised me to continue to do whatever I was doing.
Have you increased what you were doing since your heart attack?
Oh, yes. When I first started, I used to go back and forth once. Now I think I've gone, the highest I've gone so far was when I had the pool to myself, about 45 laps. For me, that's a lot. For him, it's only a little tinkle.
How does blood pressure affect aging, and how does exercise affect blood pressure?
Well, blood pressure affects aging in that if it's elevated, it's going to cause premature death. We know it to be a very strong risk factor in terms of coronary heart disease. It's an even greater risk factor in terms of stroke, so that the chances of longevity are tremendously decreased with elevated blood pressure. Now, this country has accepted as a norm 100 plus year age for systolic blood pressure. That's the elevated reading, the higher reading in a blood pressure recording, when in fact some cultures never really get above 110. So their whole life their blood pressure might be 100 over 60 or 110 over 60. Whereas in this country we've accepted for a 55-year-old person a systolic blood pressure of 155, diastolic maybe 80 or 90, which I think is unacceptably high. That this is purely a function of the environment and the lifestyle of the American population. The effects of exercise have only relatively recently been demonstrated, and that is that if the exercise program is a sustained type of activity, which would be called aerobics, for indicating the use of or requirement for oxygen to do the activity, and if it's engaged in on a systematic basis, which means at least 4 times a week and more likely 6 times a week, then we see blood pressures drop substantially. So a person who would be classified as hypertensive, that means elevated blood pressure at high risk for stroke and high risk for heart disease, and a reading of say 160 over 95, could substantially change that situation through regular exercise. Interestingly enough, the National Institutes for Heart and Lung have published a bibliography on modification of blood pressure, because in the last 4 or 5 years we've seen a tremendous emphasis on changing blood pressures. We have the National High Blood Pressure Education Program. Well, this publication for the first time has listed exercise as a therapeutic modality. Before, they simply considered diet, they considered various forms of drug therapy, to some degree psychotherapy, behavioral therapy. But now they're also listing exercise, and it's long overdue. In fact, I have in my own possession reprints of articles that are that indicate changes of blood pressure that are not listed on the national bibliography, which means they still haven't done their job yet. They still haven't looked at exercise in all its ramifications on the effect of blood pressure. Now, one of the reasons, one of the things that needs to be pointed out with respect to blood pressure is that elevated blood pressure can be caused by a number of different factors, such as blood cell mass, blood volume, kidney function, control of certain hormones that are released to the kidneys. There's probably about 12 or 13 different theories relating to elevated blood pressure. Exercise tends to modify every one of those favorably, so that the theoretical basis is there to show that exercise on a regular basis will lower blood pressures. And you see this in older people who are active. A race walker that, from New York, who was 68, had blood pressures of 115 over 65. Nowhere near the acceptable norm, and I say, quote, acceptable norm of 165 over 60. So I think blood pressures can be modified tremendously, and they have been modified tremendously by exercise in every age group and every blood pressure category. Hypertensive, borderline hypertensive, and normal tensive. They've been lowered.
Austin Newman, 62 years old.
And what event did you just finish running?
1 mile. It's my favorite event. I just took up running, this will be 3 years this February. And I've already broken the national record up in, was it Medford, Mass, Tufts University? I advise anybody to get into a program slowly, but you got to take it easy and work yourself right up to it. Because I've done it and I know what you can do. With constant practice, you can really amaze yourself at what you can do.
Professor Jane Katz.